My name is Dr. Ruben Echemendia, and I'm a clinical neuropsychologist who specializes in the evaluation and management of sports concussion. I will be talking to you about the role of baseline testing in the evaluation and management of sports concussion. Baseline testing has become popular with advances in the use of neuropsychological testing to assess cognitive or thinking abilities prior to and following sports-related concussion. Since thinking abilities, such as attention and concentration, learning and memory, processing speed and reaction time, to name just but a few, were found to be significantly impaired following concussion, it then made sense to evaluate these domains of functioning when assessing concussion. However, like with many skills and abilities, there is tremendous variability across individuals in cognitive functioning within the normal population. Which leads us to the question, how do we then interpret post-injury scores given so much variability? Sports provided the unique opportunity to actually assess an individual's functioning prior to injury and then to compare these pre-injury or baseline scores to the post-injury scores. If the injured athlete scored below their own baseline after an injury, then this information can be used to assist in the determination of whether a concussion has occurred. This baseline testing approach caught on once neuropsychological tests could be administered by computer rather than the traditional paper and pencil mode of administration. Suddenly, with these computerized tests, athletes could be tested in groups, which reduced the time and cost needed to test a large number of players. This then led to the approach of testing any and all at-risk athletes. The unintended consequence was that this almost uncritical embrace of widespread baseline testing then added time and financial demands on schools, organizations, sports leagues, and others. Some even began to believe that if they had baseline testing, they had a good concussion protocol. The reality is that a solid concussion protocol requires good acute injury evaluations and robust return to play, return to learn evaluations that are conducted and interpreted by well-trained individuals. Absent that, baseline evaluations are not very useful. Like all new ideas that are exciting at the start, it soon became clear that baseline testing was far more complicated than initially thought. Researchers began to question the extent to which baseline testing was useful in the evaluation and management of sports concussion, and whether baseline testing was even necessary for all athletes. They also then began to question whether the use of baseline testing data added significant complexity to the interpretation of test scores, which required very specialized training in order to do it adequately. Not surprisingly, there are strong positions and advocacy on both sides of this debate. Unfortunately, the scientific literature has not provided clear guidance on the need or utility of widespread baseline testing. The most recent international consensus statement on concussion in sport addressed this issue and concluded that baseline or preseason neuropsychological testing was, quote, not felt to be required as a mandatory aspect of every assessment. However, it may be helpful or add useful information to the overall interpretation of these tests. It also provides an additional educational opportunity for the healthcare provider to discuss the significance of this injury with the athlete. End quote. The Concussion in Sport group further added that neuropsychological assessment, quote, contributes significant information in the sports concussion evaluation, end quote, and should, quote, optimally be performed by a trained and accredited neuropsychologist, end quote. It should be noted, however, that appropriately trained neuropsychologists may not be readily available in all countries or all regions. The use of remote consultation and telemedicine may prove very useful in this regard. Lastly, if one chooses to have baseline testing as part of a concussion protocol, it is important that the baseline evaluation is administered in a valid and reliable manner. If not, The data may be invalid and lead to ill-informed, perhaps even dangerous return to play decisions. To this end, the Sports Neuropsychology Society has adopted the following position statement. Quote, "The administration of clinical tests, including computerized concussion baseline testing, should be supervised by a trained healthcare professional. Supervision of test administration by an appropriately trained healthcare professional is necessary when using any neuropsychological test, including those administered by a computer, to ensure validity of results and comply with long-established test standards and ethical guidelines for practice." End quote. In summary, there is no consistent evidence that widespread baseline neuropsychological testing is necessary for the evaluation and management of sports concussion. In the absence of baseline data, post-injury test scores can be interpreted by appropriately qualified neuropsychologists using comparisons to population-based normative data. However, it is also clear that individuals with unique circumstances who are not well represented by the normative data, such as those with learning disabilities or developmental disorders, those with ADHD or pre-injury psychiatric or psychological disorders, those with a complex history of multiple concussions, and others will be better served using pre-injury baseline testing for individual post-test injury comparisons. Thank you.